Good morning. My name is Donna Smith, and I'm speaking to you from Washington, D.C. I'm speaking to you this morning as a member of kind of an exclusive club. Not necessarily a fun club, but a relatively exclusive one. I was one of the subjects in Michael Moore's movie, SiCKO, that came out a little more than 2 years ago. And I shared that distinction with about 12 other American families whose stories were also told in that film. And we've been watching the healthcare debate as it's unfolded in this country over the last 2 years, some of us many longer. And we feel like it's time for us to weigh in with President Obama and with our members of Congress about what we see and if what they're doing would actually have prevented what happened to each of us. You see, we lost family members, we lost homes, we lost careers, we lost credit standing, we lost future hopes and dreams. We lost a lot, those of us who were in the movie. And we did so while we had health insurance. So what we're watching for as you work on legislation is whether or not what you pass would have prevented what happened to us. And if it does not, it's not the right legislation for this nation. So let's just look really briefly at a few of the stories. And these folks will weigh in themselves in letters to President Obama, along with another copy of the film. All of you in Congress got copies of the film 2.5 years ago, but apparently you've forgotten about all of us. But we haven't forgotten you. We haven't forgotten that you know what happened to us. How about Tracy Pierce, 37 years old, from Kansas City? Tracy died. Tracy died not necessarily because of his kidney cancer. That was his disease. What he died from was the denials and delays of care at the hands of his insurance company. Tracy and his beautiful wife, Julie, and his wonderful son, Tracy Jr., fought so hard for him to get the care he needed, and he was denied and denied and denied. And nothing in the current legislation would prevent an insurance company from doing exactly the same thing to another 37-year-old father anywhere in this country. How about Reggie Cervantes or the other 9/11 rescue workers who appeared in the movie SiCKO? Oh, sure, it was fun to watch them, go to Cuba. I went too. And try and confront people about what kind of care people get in Guantanamo Bay or don't get. That was interesting from a filmmaking perspective, but it's not nearly so interesting what's happened to the 9/11 rescue workers. Our heroes, weren't they? And yet, as many of them could no longer work because of their illness, many of them fought disability claims, some successfully, some not. Many lost their employer-based health insurance benefits and weren't able to work again or get care again. Sure, the legislation they're saying would prevent the pre-existing condition clauses, but nothing will give these heroes back what they've lost. Nothing will prevent the insurance company from delaying and denying their care once they're forced customers of these health insurance companies. So would it help Reggie? Not necessarily. No, because the insurance company could still deny her care, deny her treatment, deny payment for care. How about little Michelle Keys, 2 years old? Her mom, Donna, raced her to an emergency room when she was so sick. Wrong emergency room, said the insurance company. Can't be treated there. She wasn't. Michelle died after going to another emergency room that was in network for the insurance company. Will an insurance company be prevented from making that decision with your 2-year-old or with your grandchild? No, nothing in this legislation will prevent that. Still will be allowed. How about Adrienne Campbell, young woman from Michigan, just starting out in her life, all the hopes and dreams we all have when we're in our 20s. She got cancer. She went and got her surgery, but guess what? Her insurance company decided that that particular surgery was most effective for older women, and therefore they didn't want to pay for it for Adrian. Left her stung with thousands of dollars in bills, labeling her forever on her credit rating as someone who's untrustworthy and irresponsible. Cancer marked her that way. Her insurance company marked her that way. And nothing in the current legislation will prevent an insurance company from doing that to our young people. How about myself and my husband Larry? We always had insurance. Always had health insurance, always bought insurance, even bought disability insurance and a health care savings account. But when we got sick, the out-of-pocket maximums and deductibles and co-pays quickly ate up everything we had in a very short amount of time. There is nothing in this legislation that prevents that either. In fact, some members of Congress are patting themselves on the back because American families won't have to take out more than $11,000 in out-of-pocket debt a year. They think that'll spare us from bankruptcy. It won't. Collectors are very aggressive. Medical collectors are very aggressive sometimes. People will still go bankrupt. So what exactly is it they're fixing in this legislation? If they're not fixing the situation for those of us who've worked hard, bought insurance, and trusted that we were doing the right thing, then who are they fixing things for? Well, they're going to mandate the purchase of insurance so that every single one of us will have to buy the defective product that's health insurance. And for those who can't afford it, who are really low income, we taxpayers will pay subsidies so that those people can buy the private defective product that is health insurance. What a big boon for the insurance industry. No wonder they're not complaining. No wonder they're so graciously agreeing to cover people with pre-existing conditions. Take all comers, they say. Well, of course they will, because it says nothing about what they'll do with us once we're customers, how they'll treat us, what they'll deny, what they'll leave us hanging with in terms of debt. The American SiCKOs want to do their own markup of this legislation. Let us measure what you're doing against what happened to our lives. Let us tell you if we would be spared. And if not, then you're not doing much but an exercise in making sure the industry is protected, not the people of this nation. President Obama, we're going to give you some letters that lay out a little more detail about our personal situation and why we wouldn't be helped, so you really understand it, although I think you do understand it. And Congress, for Senator Baucus, Senator Harkin, and on the House side, Speaker Pelosi, Chairman Waxman, Chairman Rangel, Chairman Miller, Majority Leader Hoyer, we want you to understand, when you pass this thing, if it doesn't address the basic problems that allowed us all to hurt so badly that we needed to open our lives up to a documentary filmmaker and be looked at by all of the world, then you're not doing what you need to do to fix the system. And we ask you to do that. Thank you, and you can look for more communication as the American SiCKOs mark up healthcare reform.